Welcome to De-Escalation Training presented by the Grove Recovery Center. De-escalation safety training. The purpose is to provide employees with the skills to use language to diffuse aggressive behaviors and belligerent attitudes, as well as present tactics to prevent violent or unruly behavior in the workplace. The goal is to de-escalate altercations, physical abuse, and potential assaults in the workplace by presenting real-world situations and potential scenarios that could result in a workplace violence incident. The expected results of this training is that you'll have attained the skills and confidence to diffuse any life-threatening situation. What is verbal de-escalation? Verbal de-escalation is what we use during a potentially dangerous or threatening situation in an attempt to prevent a person from causing harm to us, themselves, or others. Without specialized training, we should never consider the use of physical force. Employees should always be prepared to protect themselves and need to know how to handle difficult people. We are here to develop skills, develop tactics, and diffuse situations. Do you know what to do if being personally attacked or physically threatened? First, assess the situation. Stay calm, cool, and collected. You will feel or sense it. Fight or flight syndrome will kick in. On the inside, the instincts will begin to rise. Trust your instincts, keep your cool. Think about a time in a situation that you found yourselves in regard to a potentially violent or escalating situation. How did you handle it? You will know when it happens to you. You will know what to do. Desire to talk them down, away from the cliff. Use physical language instead of physical force. Use of physical force is never recommended. But ask yourself the question, what will you do if someone verbally attacked or physically struck you? The use of physical force would only be used as a last resort to prevent injury to yourself or to another person, also known as self-defense. Use of physical force results in someone getting hurt. Could it be you? Verbal de-escalation tactics are non-physical skills used to prevent a potentially dangerous situation from escalating into a physical confrontation or injury. For example, stopping a fight. So, what are some de-escalation tactics? Simply listening. Distract the other person using the buddy system. Changing the subject. Using humor to lighten the mood. But be advised, use carefully and sparingly. Motivating the other person. Empathizing with the other person. Giving choices or options. Finally, setting limits and boundaries. De-escalating effectively. To verbally de-escalate another person, you must open as many clear lines of communication as possible. Both you and the other person must listen to each other and have no barriers. Barriers to communication are the things that keep the meaning of what is being said from being heard. Communication. Look for signs. Stay aware. Look for facial expressions, for example, clenched teeth or jaw. Hand gestures, finger pointing, balled up fist, middle finger salute. Body language, shoulder shrugging, rigid walking, pacing. Tone of voice, raising voices, cursing, screaming. Other examples are pacing, or in the real world, someone pulls a knife. Communication barriers. Anything that prevents us from receiving and understanding the messages. Some common communication barriers are prejudging, not listening, criticizing or arguing, name-calling, engaging in power struggles, ordering, threatening, or minimizing. Positive de-escalation. Stay positive and speak helpful statements like, I want to help you. Please tell me more so I better understand how to help you. Let's call Miss C. I know she will be able to help us with this. Put yourself in the other person's side of the solution to finding the problem. Look, I'm not against you. I'm on your team. Listening. 3 main listening skills. Attending, which is giving your physical, mental attention to the other person. Following, which is making sure you are engaged by using eye contact. Use unintrusive gestures, such as nodding of your head, saying okay. Reflecting, paraphrasing and reflecting, using the feelings of the other person. Empathy. Listen when you are listening. No email, cell phone, texting. Multitasking is not good when you are listening. Introduction to body language. 80 to 90% of our communication is nonverbal. It is very important to be able to identify exactly what we are communicating to others non-verbally. We may be trying to de-escalate the situation by talking to the other person, but our body language may be showing a willingness to get physical. Body language. Use your senses. When people are angry, they sometimes do not listen to the words that are being said. Remember the difference between hearing and listening. Often, they do not see and react to what you are saying with your body language. Body language eyes. One eyebrow raise could mean sternness. Eyes wide open, surprise. A hard stare could be a threatening gesture. Closing eyes longer than normal, I'm not listening, or change our message. Looking away, somebody's lying. This may be a warning that you are unintentionally escalating the situation. Giving personal space. Personal space is usually between 1.5 to 3 feet, far enough away so you cannot be hit or kicked. Do not touch a hostile person. They might interpret it as an aggressive action. Keep your hands visible at all times. You do not want the other person to misinterpret your physical actions. Read body language, how somebody is standing. Challenging postures that tend to threaten another person and escalate a situation include face to face, nose to nose, toe to toe, eyeball to eyeball, touching, and finger pointing. Protect yourself at all times. While de-escalating another person, we want to be in a non-threatening, non-challenging, and self-protecting position. Slightly more than a leg's length away on an angle and off to the side of the other person. Stay far enough away that the other person cannot hit, kick, or grab you. Tone of your voice. A lowered voice level may set a tone of anger, which can create fear or challenges. A raised voice may set a tone of anticipation or uncertainty, which may promote excitement or disruption. Speak slowly. This is usually interpreted as soothing. Humor may unintentionally offend someone and escalate the situation. Use humor sparingly and always direct humor towards yourself. Tips. Remain calm. Listen. Really listen. Avoid overreaction. Validate. I understand why you might be upset. This does not indicate that you agree with them. Bring in another trained person to assist whenever possible. There is less of a chance of aggressive behavior if 2 people are talking to one person. They also serve as a witness. Ask for help. If a situation is clearly escalating and there is a chance things could get out of hand, ask for help. 2 heads are always better than 1. There is safety in numbers. It is always a great idea to have a witness. If the situation escalates, then we have help in the same room. It prevents their word from our word. Notification and follow-up. Always report minor situations. If we address the concerns when they are small, they do not become big. Minor situations can be a cry for help and warning signs of bigger things to come. Once the situation has been de-escalated, send the client or employee to the counselor for follow-up. Document every threatening event on paper. Leave a paper trail because it typically shows a pattern. Documentation will help all parties when evaluating recurring events. This is the end of the de-escalation training. Please complete the post test. Thank you.